Good day, sir. My name is Horeb Udochukwu, a student of Iconic University, Department of Public Health. This is actually a slide presentation of a term paper that I put it in PowerPoint on PGD 742 on nutrition in health and disease. And the subject that I just want to present is examine the biological pathway through which specific dietary components, for example, saturated fats, refined sugars, and oxidants, contribute to the pathogenesis of cardiovascular disease and type 2 diabetes. As outlined in section 3.1, he also mentioned that I should discuss how these mechanisms inform evidence-based dietary interventions. The next slide actually shows my abstract in this work, and it says dietary is one of the major concerns in living a healthy life. And that's very true, because whatever things we choose to eat can actually have or play a significant role in our health and of course our general well-being too. So having this in our mind will help us to be cognizant of what we eat and consider always what we eat should be what can improve the quality of our health. Just for example, abnormal lipid metabolisms could lead to the development of hyperlipidemia. And we'll talk about hyperlipidemia. It has to do with an elevated of lipid. And lipid, as we know, is actually a fat in our blood. Hyperlipidemia means increase of lipid, while hypo means decrease. So basically, I will be talking about hyperlipidemia throughout this presentation. Just example that I mentioned before, hyperlipidemia metabolisms could lead to the development of hyperlipidemia. That is a common cause of multiple chronic disorders, including cardiovascular disease, obesity, diabetes, among others. As well, increasing evidence indicates that utilization of phytochemicals of whole foods is an alternative and promising strategies to prevent hyperlipidemia and cardiovascular disease. Although from published material there is no evidence to prove that dietary can increase the risk to cardiovascular disease. So next slide showed introduction. There is a huge literature describing the effect of diet on the risks of cardiovascular disease. And of course, this literature is often conflicting and controversial. Several well-organized investigators have actually discussed the limitations of the information linking various diet and dietary constituents and the risks of disease. For example, several observational studies show that higher vitamin E intake from dietary sources or supplements was associated with a low risk of cardiovascular disease. But randomized control trials failed to actually demonstrate this, demonstrate a reduction in cardiovascular events with vitamin E supplementations. The observational studies have also reported that vitamin B6, vitamin B12, or folic acid intake reduce the risk of cardiovascular disease. But again, randomized control trials actually failed to demonstrate a benefit of increased vitamin intake on cardiovascular disease. So as we move further on these slides, we should be able to deduce why dietary intake has actually not proven to increase lipid level in humans or lead to hyperlipidemia. So the next slide actually shows the result that point to potential deficiencies in these observational studies and the need to recognize that the associations demonstrated in observational study may not always be causal. Moreover, even the interpretation of the result of this observational trial is often debated. So, for example, a published material in 2019 on mental analysis and systematic review that is published in the Annals of Internal Medicine reached the conclusion that the magnitude of association between red and processed meat consumption and all-cause mortality and advanced cardiometabolic outcomes is very small, and the evidence is of low certainty. Like I mentioned earlier, there is no proven evidence of published material that actually says that our intake, whatever we take in, can actually lead to an increase in cardiovascular disease. There are many factors that could count for this variability, which include heterogeneity in study settings, type of individuals studies, study design, that is differences in base diet, adherence to the study diet, differences in types of diets, and dietary composition. All these put together are evidence baseline which can help us to see why our intake, what we eat, can lead to cardiovascular and not necessarily increase the level of getting a cardiovascular disease. The next slide actually showed methodology. I deduced this study using published publications online, for example, PubMed and dietary textbook by different authors, which actually help to give clear evidence of this topic. I also asked some clinicians, basically dietitians, which helps to get the first-hand information as regarding to this topic. I also conducted Google search, went through electronics search works that are actually online, which helps me to actually put all these things together. And of course, the next slide shows the result of everything. Findings suggest that dietary does not necessarily result to cardiovascular disease. And that's what I mentioned earlier, that whatever we take in as per diet does not necessarily result to one getting a cardiovascular disease. A cardiovascular disease can occur on individuals from various factors which include genetics, that is our family lineage, and of course too our lifestyle can also be a contributing factors to cardiovascular disease. Now I just want to have a brief discussion on this topic, basically on dietary saturated fatty acid, dietary cholesterol, and dietary monosaturated or polysaturated fatty acid. Let me begin by actually talking briefly on dietary saturated fatty acid. Actually, major sources of saturated fatty acid is, as we know, comprises of milk, butter, cheese, and other products like beef, like pork. Actually, also it includes palm oil, palm kernel oil, and coconut. These are actually some of the products that contains saturated fatty acid. And dietary cholesterol, primarily food sources of this dietary cholesterol are egg yolks, beef is also there, pork, cheese, and butter. These are actually dietary that constituted a cholesterol level, which when one take, it could actually increase this cholesterol level in humans. Dietary monosaturated and polysaturated fatty acid include olive oil, canola oil, peel nuts. In fact, most of the nuts that we actually take contains these monosaturated and polysaturated fatty acid. And let me briefly talk about polysaturated fatty acid in the next slides. Recent meta-analysis of the effect of PUFA on cardiovascular events in observational studies have demonstrated either no effect or a modestly lower risk of cardiovascular disease and mortality. It appears that dietary polysaturated fatty acid, that is PUFA, has a neutral effect on cardiovascular disease, except in the circumstances where it replaces SFA and results in a sustained decrease in plasma cholesterol level, leading to a decrease in cardiovascular event. Let me talk about sugar and cardiovascular disease. And the purpose of this report is actually to review the effect of dietary sugar on health, with an emphasis, not other diseases this time, but on cardiovascular disease specifically, and its risk factor. Although there are no dietary trials linking sugar consumptions and cardiovascular disease. However, there are several reasons why sugar consumption should be limited, just like what we know. Most times it's actually good to educate people, to tell them to limit their sugar level intake, especially those minerals that contains a lot of sugar that people take on daily basis. There is no direct link though on its effect on cardiovascular, but there are other pathologies, other abnormalities that could result to excessive intake of sugar in the body. A recent report from the Norse Health Study showed that women who consume diet with a high glycemic load, that is high level sugar, increase blood glucose, and excursions associated with intake of sweets or highly processed starches and sweet had an increase, that's the interest now, on CHD risk, that is cardiovascular heart disease, with those in the highest quantity having up to 10 years and a follow-up. So what I actually mentioned here has to do with hyperglycemia, that's increase in sugar level. Although there is no published material that actually mention how highest sugar intake can have effects on cardiovascular disease. But there are proven evidences to show that higher sugar intake can lead to other diseases, especially cardiovascular heart. And that is why it's very important to actually educate people around us in our community the risks of higher sugar intake. Now, I also want to mention dietary sugar and plasma lipoproteins. A number of studies link dietary sugar with advanced changes in lipoproteins. Several studies have shown an inverse association between dietary sucrose and high-density lipoprotein cholesterol. Data from coronary artery risk development to young adult, that is CARDIA, study showed a consistent inverse association between increased dietary sucrose intake and HDL cholesterol concentrations. In both cross-sectionals and longitudinal analysis in blacks and whites, both blacks and white actually experience this in both women and as well men. So this should always be in our mind of dietary sugar and plasma lipoprotein. Dietary sugar insulin resistance and diabetes. Few epidemiological studies have directly examined the relationship between sugar intake and diabetes incidence. In general, prospective data show no association, and in fact, several dietary studies show an inverse association between total carbohydrate intake and diabetes incidence. On the other hand, two recent prospective cohort studies have reported food frequency consumption data that shows that a history of consumption of food with a high glycemic load predict the development of type 2 diabetes in women 17 and in men 25. Now, let me talk a little bit about antioxidants. As we know, diabetes is an oxidative stress disorder as a result of both hyperglycemia and increased level of free fatty acid. Next slide actually shows effect of specific foods on cardiovascular disease. Like I mentioned often and on, there are a large number of observational trials linking various food with either an increase or decreased rates of cardiovascular disease. A large meta-analysis by Michael et al. Reported that fruits, vegetables, beans, legumes, nuts, whole grains, fish, yogurt, fiber, seed food, omega-3 fatty acid, polyunsaturated fat, and potassium were associated with a decreased risk of cardiovascular disease, while unprocessed red meat, processed meat, sugar, sweetened beverages, and sodium were associated with an increased risk of cardiovascular. So we want to take note of these two things. The one that can actually increase cardiovascular disease and the one that can actually decrease the cardiovascular disease. That's having effect on patients. A similar meta-analysis by Bakor et al. Also found that whole grain vegetables and fruits, nuts, fish consumption were associated with a decrease in cardiovascular disease, while red meat, processed meat, and sugar-sweetened beverages consumption was associated with an increase in cardiovascular. And that is actually to back up what Michael et al. Mentioned in his write-up. So Beckett also supported that notion, what can actually increase the CVD level and those that can decrease the CVD level. Now, let me talk about a little bit on the next slides on major cholesterol regulatory mechanisms of phytochemicals, the acceleration of reverse cholesterol transport. Plant-based whole food reducing LDL-C and contributing to prevent cardiovascular disease. That's mechanisms that can actually help to prevent cardiovascular disease are the things we're talking about now. Remember, in the next slides, I mentioned insulin intake, which can actually bring down the hyperglycemia level of individual, and this can be what can help to target a role of bringing hyperglycemia, which will automatically lead to decrease in this cardiovascular disease we mentioned. The intake of vegetables, fruits, and dietary fiber have been reported to have positive effect on serum cholesterol level and platelet aggregation. That's also another thing we need to take note of. That is vegetables, fruits, dietary fiber. These are actually what can help to reduce the level of cholesterol. Findings shows that various clinical trials have found that grape polyphenols are effective against cholesteremia. For instance, Vermeer et al. Reported that compared with a placebo, the intake of grape polyphenols for 2 weeks lead to decreased TC and TG levels. A study of 44 premenopausal women found that dietary supplementations of lyophilized grape powder can actually reduce the serum level of LDC. Furthermore, administration of grape polyphenols for 3 weeks and consumption of red wine for 1 month was reported to reduce these LDL levels, and as well this can lead to the risk of cardiovascular disease. I also mentioned some of the effects of cribarias on this CDF, which shows on the next slides, and the next slide shows pomegranates, which contains several potent antioxidants which act as an effective anti-atherogenic agent. He mentioned that daily consumption of a pomegranate juice had been shown to reduce serum LDL-C and TG levels and to increase HD levels in the body. And so, totally, the considerable amount of steroidal compound in pomegranate seed oil were reported to decrease cholesterol level. These are also things that could also help when we take it, that could help us to actually manage the cholesterol level and not to lead to hyperlipidemia. A study of the effect of concentrated pomegranate juice on cholesterol profile of type 2 diabetes patients with hyperlipidemia reported that daily intake of 40 grams of pomegranate for 8 weeks effectively reduced this TG level of what we are actually talking about. He also mentioned in the next slides vegetarian diet, that is being a vegetarian, exclude meat, poultry, and fish. Vegan diet, in addition to the exclusion of vegetarian diet, also exclude eggs and dairy products. Health benefits of vegetarian diet are due to the presence of adequate quantity of fatty acid. It could also include fiber, it could also include folate, ascorbic acid, vitamin E, and magnesium. Scientific opinion suggests that a person does not need to become vegan or vegetarian to improve their cardiovascular health, but slight changes in dietary components and habits might do the needful. And that's why I mentioned earlier that possibly not what we take that can actually increase the cardiovascular level in humans. No. What plays major role here is actually a habit or family lineage, just like I mentioned in the early introductions of this presentation. We also need to take note that vegetarians and Mediterranean type diet have been recommended by health clinicians, which can actually help to manage the level of hyperlipidemia, which can control the CVD that we are talking about, which is the subject matter. So the next slides also mention a meta-analytic study of 11 trials that was conducted to observe the effect of vegetarian diet on lipid profile. A random effect model was used for determination of net changes in lipid profile. Vegetarian diet caused significant reduction in TC and LDC without having significant effects on lowering triglycerides. A meta-analytic and prospective study reported that vegetarian diet continues for 5 years or more reduced the risk of mortality from CHD by 24%. Which reminded me that it's very important to encourage people to actually take vegetables, which is one of the major sources of food that can actually improve our health. We see what we mentioned again and again here, how vegetarian vegetable intake as per diet can help to reduce the risk to cardiovascular disease. In conclusion, what have I mentioned so far? Why diet can significantly affect lipid levels, either to hyperlipidemia or to lower lipidemia, that is hyperlipidemia and hypolipidemia level. It should be recognized that the effect is typically relatively modest compared to drug therapy. take note of this, please. This helps us to see why diet is not the basic thing there, but drugs or therapy. Whether this modest effect on lipid levels can reduce the risk of cardiovascular disease has not been tested in randomized control trials, and given the difficulty of carrying out such long-term diet studies, is likely not to be attempted. However, diet therapy can be initiated early in life and has the potential to result in long-term decreases in lipid levels. It is likely that a similar long-term decrease induced by dietary changes could also be effective in decreasing cardiovascular disease. So that's what I actually mentioned here, and in conclusion, reductions in lipid level induced by diet therapy may reduce the lifetime risk of developing cardiovascular disease. Of course, I want to thank the lecturer for giving me this opportunity to pierce into this topic and then being able to find a little knowledge of what actually helped me to find out risks to this cardiovascular disease. Before, my total knowledge is whatever you eat can have direct effect, can actually increase the level of cardiovascular disease. But through this work of this research really helped me to broaden a little bit my knowledge on what can actually induce cardiovascular disease, and what I find out can actually help both me and in my community too, to actually help use this little knowledge to educate them on basically what could lead to increase in cardiovascular disease. And the advice there can also help me to be effective in the community where I work and in my family as well, to help them. Thank you very much, and I appreciate the opportunity given to me to actually help a little to give this presentation on these slides. Thank you, sir.